Biotechnology in the world of sports. What is autologous platelet-rich plasma? Autologous platelet-rich plasma, or PRP therapy, is a fairly new biotechnology application that focuses on improving the initial healing process for bone and soft tissue injuries. Firstly, PRP is produced in a human's blood. Specifically, it is a concentration of one cell type which are known as platelets. The platelets portion of blood is the part that contains many of the factors that are essential for growth functions in a cell, such as cell multiplication and cell recruitment. What are the benefits? PRP treatment offers benefits for a wide variety of injuries, such as muscle or tendon strain, bone fractures, and ligament strain. The main benefits are a reduction in pain as well as a faster recovery from these injuries. While I decided to focus on how PRP injections help speed up the recovery process for injuries, PRP has been shown to be helpful for hair loss and acne as well. So overall, PRP injections have a wide variety of applications that can benefit many people. How is it used? PRP therapy is administered through injections containing a concentration of the patient's own platelets. This is accomplished by first drawing blood from the patient. Once a few tubes of blood are drawn from the patient, the blood is run through a centrifuge to concentrate the platelets. Once concentrated, the platelets are then injected directly into the injured body tissue. Once this happens, growth factors stimulate the injured tissue, thereby increasing the number of reparative cells in the body. This process is sometimes accompanied by ultrasound imaging in order to help guide the injection. What methods were used to develop it? PRP therapy is only possible due to the expanding application of biotechnology. While I believe that PRP therapy is revolutionary for healing bone and soft tissue injuries in its own right, the centrifuge, a crucial component of PRP injections, has been around for a long time. It was invented in 1864 and was originally used in the dairy industry, with its main function being to separate milk and cream. However, it wasn't until the 1970s that the concept of PRP was created. This is the point in time that doctors could define blood that had high platelet counts versus low platelet counts. Finally, in the 1990s, PRP began to be used for surgical procedures, which eventually gave rise to the PRP injections that we have today. Is the use of PRP ethical? I personally believe that the use of PRP therapy is ethical for healing purposes. This treatment has the ability to lower the time needed to recover from various injuries, as well as reducing or eliminating any pain from said injuries. PRP therapy is a treatment that has the potential to help athletes as well as non-athletes recover faster and return to optimal functioning levels. While there are few that would argue that PRP treatments are unethical, PRP does contain growth factors which lead some organizations to believe that PRP treatments are no different than performance-enhancing drugs. In fact, the United States Anti-Doping Agency doesn't allow the use of PRP injections as they believe the growth factors could enhance a person's performance. Despite this, there is no evidence that PRP injections enhances performance. Conclusion. In conclusion, PRP therapy is a very beneficial, relatively new biotechnology. With the wide array of injuries that PRP therapy can treat, as well as the relatively low cost, I'm sure that it will one day be a common treatment that will help benefit many people.